and welcome to the Totally Adequate podcast. I'm April Bean, your host, and this is a new segment for us around policy updates. We're going to be doing this segment monthly to bring you the latest and greatest information you need to know, in particular about network adequacy and provider data accuracy policy that impacts you. Joining me today here on the podcast is Kate Dieters from Quest Analytics. She is in the granular details of policy updates. In fact, I think Kate brings popcorn to the table when she's reading an omnibus bill for sure. So she is our local expert and going to be a regular here on the Totally Adequate podcast. And of course, Kate, I didn't get the memo, but we matched anyway for today. So red is the thing today, I guess. But I know we have a lot to talk about. There's a lot of things happening around final rules, in particular around the marketplace and Medicare Advantage. So thank you for joining us here today. And why don't you get us started on these final rules?
Absolutely. Well, it's my pleasure. And thank you, April. Like you said, a lot is going on. A lot's always going on in our industry. And so, like you said, starting off with the final rules, we saw a couple months ago, both the Medicare Advantage final rule and the marketplace final rule were released. And so starting with Medicare Advantage, the biggest thing out of that final rule for anyone that's following network adequacy and provider data accuracy would be CMS has added another behavioral health specialty to the list of providers and facilities that Medicare Advantage plans have to offer within their health plans. And with our clients at Quest Analytics, I know this has been something that's on their radar and has been on their radar, because for a health plan, that means that they have to look at, do we already have these people contracted? If we don't, how do we go out and make sure that we can get them contracted by the time that next year rolls around?
Awesome. Now, you mentioned that it's a facility specialty, I think, but not to be misleading, because it's not just facilities that are rolled into that particular specialty, correct? CMS is actually looking at a variety of different specialties. They're just rolling it up into that facility. One, is that correct?
Correct, April. Yes. And there's a whole slew of specialties that are rolled up right now under outpatient behavioral health. And we will definitely have a link for more information for anybody that wants to see that in great detail. But we said CMS had wrapped up a bunch of different specialties, everything from marriage and family therapy to prescription medication. And this is really them just seeing what they feel and what the health plans feel are going to be the most beneficial from that standpoint. And then, as they always do, they will review it every year, get feedback from the plans out there, and make any type of revisions if it seems that what they currently have just decided on is not the best fit. But yes, there is. And there's also another requirement that comes with with that outpatient behavioral health. And the one disclaimer there that CMS has put out is that the health plan can't use a provider to kind of, we'll say, like double dip on their network. So if they currently have one of those providers that they're using maybe as their psychiatry or their licensed social work, they can't use that same provider to fulfill the outpatient behavioral health requirement. So that would be something, again, as plans are thinking about looking at their current list of contracted providers and facility types, just to kind of keep that in mind as well.
So, Kate, we talked about how the behavioral health specialty has been added, but there's some additional requirements that go along with the activity associated with those specialties as well. Did you want to touch on that a little bit?
Yes. Yeah. And what CMS is really looking at is they want you to be able to demonstrate. So they want you to be able to prove. I always think back to, I don't know if it was elementary or like middle school, but it's one of those great years we heard that phrase, like, you've got to be able to show your work. Right. And so that still holds true today. And so, like you said, CMS is allowing, whether it be claims-based activity or some other type of a verification type of documentation that can show that the providers really are kind of having that receipt of, I provided services, here's that receipt, here's my proof that I did that, rather than a plan just saying, oh yeah, they did, and not having to show any work to back it up.
Right.
And So one of the things that plans are going to have to also do, because that they're going to have to independently verify that information. So a lot of, we hear from our clients here, but just knowing again, the industry, a lot of those plans are out there trying to assess their current process. Is this something that they already have baked into their current process? Is it something that they should be looking at somebody else to come in and help them with? So I think that this is their way of stepping towards it by bringing in this additional documentation, claims-based information to say, yes, these providers that we have listed on our directory and that we're counting in our HSD tables are actively seeing patients.
And I'm sure you'll provide a link for everyone as to what those are. Fantastic. Moving on from Medicare Advantage, let's talk about the marketplace. A lot of things happening there.
So for the first time, CMS has gone out there and said, anyone that's on the state-based exchange or is using a state-based exchange with federal platform, easiest way to think about it right now is if you are a health plan in a state where the state is currently overseeing your QHP certification process, that state now has to, as a bare minimum, bring the network adequacy requirements in alignment with the federal requirements. And so that's everything from the time and distance network adequacy requirements to the process in terms of making, the states will have to make sure that a plan is submitting their network prior to being certified as QHP. There will also be an exceptions component to that. And they're also asking for information on whether or not providers are accepting telehealth services. And that it's not so much a part of the network adequacy requirements right now, but it's another leg where CMS and states are trying to really use that information to make better decisions around, do we want to add in a telehealth credit? Do we not? Kind of what do we want to do? And so that first step in that process is having plans submit the information so that they have that readily available for them, and then they can go from there.
So, Kate, in a quick recap, what are you seeing as trends right now in the policies that you're watching around data accuracy and network adequacy? What are some of those trends we should be watching?
The one that jumps out to me, Mike, because we were just talking about it, but it's really going back to those states who are trying to get ahead of aligning their current requirements with this federal government. And as we always say here, April, can sometimes take an act of Congress, or maybe it's just a legislation session. Either way, we are seeing a lot of those plans starting to do that. And because everyone is kind of having to do it on their time, we are seeing some states where they might only be aligning with the dental component, but in the next legislation session, they'll be bringing in the medical side of it. Some are being able to do all of it in one swoop. So I would say if you are in a state right now that you currently have, again, your state has that oversight process, definitely keep an eye on what is changing in your state, because I think that's going to be one of the biggest things that we see, because we're already seeing it. We're going to continue to see it as we go forward over the next probably at least 6-9 months. They don't have a lot of time to make that change, but they'll do it. So that would be definitely one of them. The other component that we're seeing, going back to the provider data accuracy side, is that a lot of the states are also adding in that claims component, or that extra level of demonstrating that, yes, the providers that I have listed on my directory or in my data that I'm using to go and sell my health plan, they are active providers. They are able to see patients. They're able to accept new patients. And so I'd recommend anyone to really keep an eye on what's happening within their state, because that's where we're seeing it the most.
And of course, you'll be watching it as well. And we'll bring updates as we can on this monthly segment that we're initiating today. So more to come. I'm sure that you'll be following all of this in depth and bring us more trends and information next month. Kate, thank you so much for joining us on the Totally Adequate podcast. I look forward to you coming back month over month and helping all of our listeners understand better the impact that these policies have on them and the strategic plan that they have in place in order to build their networks and create access to care for their members. So thank you for joining us. Thank you, all of our listeners, for joining as well. We know you have a lot of options of places you can go for your podcasts and information. We really appreciate that you're here joining with us today. And also, please give us any feedback. We take that seriously, and it helps us make our podcast even better. So thank you all for listening. Kate, thank you, and we'll see you again next month.